Hello and welcome to another episode of Inspiring Women Leaders. Today, I'm really excited to welcome to the show my friend and fellow physician coach, Dr. Riva Kamat. Dr. Kamat is a practicing physician, parent, coach, entrepreneur, mentor, and speaker. She's the founder of Lotus Clinician Wellbeing, a company that consults with medical organizations to provide group coaching, evaluations, webinars, and retreats for their clinicians to maintain professional wellness. Dr. Kamat is passionate about helping all clinicians deal with the stresses of a life in medicine, helping them achieve a work-life integration and create the life they've wanted. With over 20 years of experience within an academic and community practice, Dr. Kamat has personal experience with the ups and downs of medicine. She's the chair of the American Academy of Pediatrics, section of hospital medicine, provider Wellness Subcommittee, and the founder and co-chair of the Virginia American Academy of Pediatrics, provider Wellness Committee. She's a certified professional coach and enjoys coaching attendings, residents, and medical students on a wide range of topics such as imposter syndrome to setting boundaries. I think it's fair to say that Dr. Kamat is leading the way with inspiration. So without further ado, let's meet Dr. Riva Kamat. Welcome to the show, Riva. Thank you so much for agreeing to come on and speak to my audience.
Thank you, Adam. It is a pleasure to be here, and congratulations on the launch of your program. I'm very excited for you.
Thank you. Thank you so much. That's really kind. Okay, so let's start with talking about yourself in your own words. If you could tell the audience a bit more about who you are, what your current work roles are, and what leadership positions you currently hold or have held in the past, please.
Yes, so my name is Riva Kamat. I am a pediatric hospital physician, and I am an entrepreneur. I love coaching physicians, coaching physician assistants and nurse practitioners, all clinicians really. And we, at my company, and it's called Lotus Physician Coaching, and I also, the name actually has been rebranded to Lotus Clinician Wellbeing, and we are consulting with medical organizations that have needs on clinician well-being. We do assessments, we do all sorts of things, webinars, and I love just meeting other people who are doing other things very similar to their clinical roles. So some of the leadership roles that I have had, where I have been the CEO of this company, I have been the CEO of another company in a medical expert witness business. I also held a leadership role as the medical director of a community hospitalist program and was leading about 7 or 8 hospitalists at that time. And I've been just really enjoying my CEO leadership role in my own company today.
Yeah. Cool, excellent. Thank you for that. And you founded a regional Academy of Pediatrics as well. So that's amazing. Can you tell us a little bit about that?
So in Virginia and nationally, there are over 500 pediatric hospital physicians, and they all have their certain stresses, and they have times when they are burning out and need a sense of community. So I was one of the co-founders, and we started a program called Provider Wellbeing amongst our pediatric hospitalists. And this is affiliated with the American Academy of Pediatrics here in the United States.
Excellent. Thank you for that. So what would you say with your various leadership hats on is your personal leadership style?
It is very empathetic. It is a very caring leadership style. I like to know the people that I'm leading. I like to know how they tick and how they work and how is the best way to communicate with them, and how is the best way to think about working with them in their highest capacity. So I always sort of think about that space of everyone is always trying to do their very best work. Everybody's always trying to do their highest level of work. And so we want to empathize with them, and I want to be able to really connect with them at a personal level.
Thank you. That's lovely. So, as you say, that knowing them really well, knowing what makes them tick, enables you to work out what their strengths are, and so what kind of roles and tasks and things that you ask of them. But also, you're getting to know them; they're getting to know you. So there's that kind of personal relationship there as well. So they know, gosh, this leader's really interested in me. They care for me. They want to know about my family setup and all of this sort of thing. So which is so lovely, isn't it? And kind of makes people feel valued and more part of the team.
Yeah, that's really important. Yeah, that's really important to me, to make sure that they do feel valued, that they're not just a cog in the wheel of this work life.
Yeah. And do you ever get any feedback along those lines directly from them?
Yeah, I have been told that I've been one of the best kind of bosses with them, that I work really well with people, and I am a wonderful leader.
Yeah, well, I can truly believe that. You're very, very easy to get along with. So that's fantastic. Okay, so can you tell us about your journey to leadership? So obviously, you trained as a pediatrician, so did you have leadership roles in residency, or did it come afterwards? What's your story?
It came afterwards. I've always wanted to have these leadership roles, and there've always been blocks. And even when I decided to go into doing some leadership training with the section of hospital medicine, there've always been these stumbling kind of blocks for me. And I have had to go through a lot of growing up and a lot of learning to be where I am today. And just to sort of share a story is that I had a leadership role, and I was asked to step down from that role because I became this person that I didn't want to be. It wasn't quite the right fit. And that's something that's really important, I think, for listeners to know. If the setting isn't the right fit, if you have to step back and evaluate things, I think that's okay. And you have to give yourself permission to do that.
Yeah. That's really really good advice, and just be compassionate to yourself and forgiving of yourself, or however it makes you feel, and I think it's unrealistic, isn't it, to expect that we're just going to be put into a leadership role or offered a leadership role, and we think, oh, we've wanted to be a leader for a while, so I'll take it, and for it to be a perfect fit and to click, because there are your values, and you have to do work that's aligned with your values, and are they in alignment with the organization, the system, your colleagues? There's so many variables, aren't there? So that's really good advice. I think as doctors, we do put mostly perfectionists as well, so we put a lot of pressure on ourselves that every single thing that we do, we're going to get right.
Right.
And
sometimes you don't. You don't get it right. And you learn a lot from your failures. And sometimes the roles that you think you want to get into, and you're there, and there's a lot of tussle kind of back and forth. And you think, oh, this is the right journey for me because it's something I've always wanted. And then you realize, no, this is not the right fit for me. and you have to, you have to step down, or you're asked to step down, and then you sort of find your way into doing things that are a better fit for you. And that
Yeah.
was for me developing my own company, like Lotus Clinician Wellbeing, like the ability to go out kind of on my own and do coaching and do consulting for medical organizations.
Yeah. So that had a fantastic knock-on effect for your career trajectory, didn't it? It kind of made you realize that actually, I want my own organization. I want to lead it myself, and I can create it and lead it however I want to. I'm not going to be constrained by this organization that I'm working in or whatever, because it's, it's all mine. So, and you're right, if it's not meant to be, it's not meant to be. And in your case, one door closed, and then you had an epiphany. I'm going to create my own company, and that door opened, and you haven't looked back. So great.
And I still enjoy doing my clinical work, even in the same location that I was asked to step down. And I think that for me is a big shift, to say, I'm here because I want to enjoy doing this clinical work. But in my leadership role as the ex-medical director, I needed to learn some big lessons that, like we talked about, it's not the right fit. And to amplify your point about moving on when you need to move on, that's okay, so good.
Yeah, absolutely. That's great. Thank you for that. So kind of as you moved into leadership roles, were there any doctors who were senior to you, female or male, that kind of helped you along the way?
Yeah, there was a male chief medical officer who actually works with me at the Virginia Medicaid program, and is a wonderful leader. He looks at everybody's different. He looks and asks for everybody's opinions. He is sort of the epitome of what good leadership looks like in a very big organization. And he really sort of looked out for me, and shared with me some of the lessons, that he has learned in his own journey. And, one of the biggest lessons is to sort of listen to what people are saying and not always insert yourself into the conversation. Sometimes it's okay just to listen, right? And allow people to speak, and then think about things, and then form your opinions. Sometimes I think I am so reactive at times that I need to give my opinion all the time. And one thing I've learned is you can actually sit back and you can let things be, and then formulate your opinion, and then give your opinion after you think about things.
Yeah. That's a really, really good tip. Allow that space.
Yes.
And it's so insightful of you to kind of have reflected and look back, and realized where there were areas for improvement, because like I sort of alluded to before, sometimes we just thrust into leadership roles, and we don't have any training. We're trained on communication skills with patients, and a lot of those are a very good foundation and can stand you in good stead for communicating with other people, of course. But there's something very different about communicating with your fellow senior medical colleagues and your trainees and things like that. That's requires some special training that's different from communicating with patients. And we're not taught leadership skills or anything like that in med school or residency, are we? So, but we expect.
No, absolutely, Adam, you're so right. And I think it's so important to understand the other side of the people you're dealing with. The people that you're leading, you're coming sometimes into a setting where their perception of you, their values, their viewpoints are completely different. Their cultural values are completely different than your own. And it's so easy for all of us to impose our ideas, our values, and sort of like tell everybody what we're thinking and what we want to do without just stepping back and saying, you know what, let me listen to your ideas. Let me hear what you are doing and what you're saying, and be compassionate.
And a couple of my other guests have said very, very similar things that, early on in their medical career, and when we're younger doctors, maybe recently finished residency or fellowship, and it's your first attending role, you're reinvigorated, you're just starting as a specialist in your own right, and there's all that kind of energy and excitement, and your work ethic is incredible, and you want everyone to kind of like work 20 to the dozen like you do, and but not everyone wants to kind of like work the crazy hours that you want to work, and kind of like see these projects through to fruition in as short a space of time as possible. So I think it's really important, you're right, not to impose your own values and ethics and so on onto your colleagues. That's very key. I like that. Thank you.
Yeah. And to sort of listen to what's been happening. So I was in a situation where the people in a new sort of setting to me had been there for a very long time. And I thought, well, I'm going to be the new girl. I'm going to change all these new things. I'm going to bring all my new ideas. And that didn't work. It just does. You have to sort of listen to what people on the ground have been doing for all this time, and be able to work with them in a non-combative manner, and that's a very humbling kind of situation where you take time and say, oh wait, let me just sort of look at this through their lens.
That's so wise, because it's such a common scenario, isn't it? You must have seen it a handful of times. I certainly have. The new person comes in, and we see it in politics all the time, don't we? And they want to claim the territory as theirs, exert their influence, and this is the new way, this is my way, so it's my way or the highway, basically. So you either do what I want, or else you're welcome to go elsewhere, kind of thing. And it's such an old mistake that just seems to be repeated, isn't it?
Absolutely.
Why are people not learning?
I know. And because I don't think people have a chance to reflect on what happened. I don't think that people have a chance to sit back and kind of say, well, what was it that I needed to do in this situation? And how can I do a little bit better moving forward?
Yeah, absolutely. And it's probably because there just isn't time, is it? You get into this leadership role, there's 100 things to do, you've got your clinical commitments as well, and it's like you just need to get on with it. And there is no reflection time, as you say. So
there isn't. And it's a lot of ego as well, Adam. I mean, I think that all of us have these egos that can be a little bit fragile, right? And can get bruised up very quickly. And some of those are the hardest lessons to realize, when your ego is bruised and you're thinking, well, why didn't they do X, Y, and Z when I told them to do X, Y, and Z? And then you're like, wait, let me sit back and like really try to listen to what they're saying.
Yeah, that's great. Very true, very true. I mean, you've kind of alluded to some challenges, but have there been is there anything else prominent that you're kind of comfortable talking about? Where you've experienced any bullying or discrimination or harassment, or
Yeah, there was definitely early on in my career. There was a medical director that I used to work with who was a bully, and she was a woman who had, to her credit, kind of fought her way up to the top, and she did not want to share her her advice with anybody else because she thought that somebody was going to try to take her down. And there was a lot of intimidation and there was a lot of workplace bullying. And it was a very difficult time. It was an extremely difficult time.
Yeah. I mean, as you know, it's something I'm very interested in, and the kind of psychological and physical impacts of bullying. The sort of invisible consequences of it are very far-reaching, actually. So I'm sorry you went through that, and I totally understand that kind of situation. It's a funny one, isn't it? Where it almost like, because she wasn't willing to share advice on how she had kind of got to where she was. It's a bit like another, I don't know if it's a purely medical phenomenon, but there's a lot of attendings and consultants out there who, think, well, I went through that crap as I was training and getting into my leadership role, so they have to go through it too. It's character building, and my inner monologue, and it's not so inner now, I'm quite happy to share it, was always, but I'm, by that stage, I'm in my late 20s, I'm in my mid 30s, I'm in my late 30s. I have enough character. I don't need any more character building. Thank you very much. I just need you to help me, actually, is all I need. I just need you to be kind. It's very odd, isn't it? And that the other side of it, it's almost like, some seniors, they get above the glass ceiling, and then they close the hatch behind them, don't they? And it's
I think that's an excellent way of putting it. Right. That's an excellent way of putting it. Yeah. Closing the hatch because they don't want anybody else on top of that glass ceiling. Right.
Yeah.
And it's kind of interesting that women do this to each other, actually, because they don't want you coming for their jobs, their roles, and many of them feel very threatened. And I think that's really an interesting sort of area to look at. And, why do they feel so threatened? Why do they not want to help other women? And the current situation I'm in now, I mean, these are the women that I work with do help each other, which is really a wonderful thing. But many, many years ago, they did not. And it was very, very detrimental. It was very detrimental because, I think because you're not helping each other and you're almost sort of doing this sort of stabbing each other in the back, that it reduces a lot of, your sort of career lifespan as well. And it influences the way you teach your learners. I teach residents and I teach medical students, and it's very, it's one of those shifts that you're so happy that they're happy that, the women in your current role are women you can count on to be there for you and not stab you in the back.
Absolutely. And you're right. It's, when people are behaving like that and they're in senior positions, the younger generation, the students and the residents they're looking to these people in senior positions for a steer on how to behave. And I've experienced countless clients who've told me, that they've seen their seniors, kind of like residents or whatever, behaving really quite badly, but they could tell that they're modeling themselves on the behavior of the attendings, and they think they must think, well, I want to be that person one day, and this is how they behave, so in order to become that person and be an attending colleague of theirs, I need to behave like them.
Yeah.
and that's how I will become them.
Yeah.
Um, and yeah, it's very sad to see a lot of kind of female residents, modeling on, kind of challenging white male seniors, and
Mhm.
becoming like them. It's it's sad, but this is where good leadership training comes in, isn't it? I suppose.
It is, and I think it's also really important to talk about just workplace hours, because so many of us work, 13, 14 hours per day, and we're coming home exhausted. And that's what we're modeling for our residents and our medical students, to work these, incredibly long hours and burn ourselves out, versus actually coming home and spending time with working out or exercise, or spending time with our family, or cooking and enjoying a nice dinner with our family. So I think it's so important that we model really good behavior, to say you should, and you give permission to take time off for your own health. If you have a doctor's appointment, if you have a medical emergency, if you have a mental health appointment, take time off to do that.
Yeah. Yeah, it's a funny one, isn't it? It's in the UK, it's almost, when you seeing patients and they're saying, "Oh, can you write me a note to excuse me from work because I have a doctor's appointment, a hospital appointment," and you're like, "Well, why are you coming to me and asking me to do this? If you had a dental appointment or an appointment with your lawyer, would you have to get a letter from me or something?" They're like, "No." I'm like, "So let me get this right. You need permission from a doctor to have an appointment about your health." That it's very strange. I mean, you're right. There's a lot of messed up workplace stuff that goes on. And then, as you've said, not only are you working these really, really long days, but I've learned a phrase in the last few days from one of your wonderful co-interviewees on the show, talking about the second shift. So when you have children like you do, you're then coming home and sorting out the home and the kids and then the family and the meals and the evening routine and all of that as well. So you're kind of holding down 2 full-time jobs.
That's right. That's
But
right. And, so many of us also, we need to pay our bills. We need, so there's that whole financial piece to it too. And then, taking care of yourself, I think, is so important. Are you able to do the things that you want to do? To be able to, I enjoy swimming, I enjoy cycling, are you able to do those things to maintain your own health? And the creative aspects, like you started this podcast, this is just a creative love for you. But it does take time, and it does take some bandwidth to do that.
Yeah, for sure. So can I just ask then, when you had those difficult encounters with that female leader, how did you personally cope with that bullying, and how did you eventually kind of get some closure and move past it?
Yeah, to be frank, I ended up crying a lot. I ended up coming home and crying. I ended up doing some journaling about it, but I don't think I coped really well at the time. And I was younger when it happened. I had just kind of started out my career as a pediatrician, just was finished residency about 5 years out or so, and I really did not know what to do. There weren't any really available programs. There certainly weren't coaches like you, amazing coaches, to talk about workplace bullying. And I don't think I did very well. And the way it ended was that the bully ended up getting fired from the position because of several complaints and other things that were going on. But it's so important to, and this day and age, to find resources like your employee assistance program and mental health programs, leadership programs, and coaches like you.
Yeah. Well, that's interesting, and obviously I'm so sorry that you and your colleagues suffered for such a long time until that person was removed from the organisation. But it's interesting to hear that, because oftentimes they find a way of retaining their job and or maybe they just get moved sideways or something else, and they're you're out of their direct firing line, but the organization still keeps them. So it obviously took a while, but at least it sounds like the organization did the right thing by you guys in the end.
And this person had been there with this organization for 15 years. So, it was a long time. And you're right, organizations don't usually, let people go. They'll move them to a different division. And then they're quote unquote somebody else's problem. But
that's it. It's someone else's really problem. Hard. They'll close ranks, won't they? And deny there's a problem often. It's like bullying. There's no bullying in our organization. That'd be silly. And then they start gaslighting you, and that's another form of bullying. And so, well, thank you for sharing that. I really appreciate that, and I know our listeners will find that really valuable. So in addition to that excellent advice around navigating your way through those challenges, do you have any other advice for our listeners on how to become a strong and kind leader, which is certainly how you appear to be now?
Oh, I think, keep being curious about learning by various means, listening to amazing podcasts like your own with inspiring women leaders, going to conferences. You and I both connected on a group. It was a Slack group for physician coaches and leaders. And so, I would say, Adam, find your tribe. Find people who are doing things that you want to do, doing places you want to be. They say you're like your composite of the 5 people you spend the most time with or hang out with. And so I think it's really important to keep reading books on leadership, listening to podcasts like your own, getting in groups, getting in mastermind groups, just keep yourself engaged.
Yeah. That's wonderful. Yeah. Thank you for that. Definitely agree with all of that. And the finding your tribe thing is so important. People who are, have similar values, shared values, that you're in alignment with, because that can be such a cause of kind of internal unhappiness when then there isn't harmony with the people that you're associated with. So, that's great.
May I say, Adam, that I am so glad that you're part of my tribe. And so thank you for that.
I was going to say the same.
And can I just share with your listeners that don't be afraid to just reach out to people and, call people that you cold call, or Instagram message them and say, hey, I really like what you're doing. Can I just jump on a conversation with you for 10 minutes? Because I'm one of those people, and I know you and I have talked before, that you're like, hey, share with me a little bit about what's going on. How do you do what you're doing? How can I do some of those next steps? And it's so wonderful to be able to be a mentor or even be a mentee for other people, And so I would just say sometimes people are very hesitant about contacting other people, but I'm one of those people who loves to mentor and help other people and elevate other people. And so I always welcome those phone calls, and I will always make time for people who say, hey, tell me what the next steps are. This is what I want to do. How'd you get there?
Well, I can 100% speak to that, because I think you posted something really helpful in the Slack channel, and I then reached out to you and I said, oh, can you send me this? And then it became, can we have a phone call? And you very generously kind of gave me an hour of your time. We'd never spoken before. We had a really good chat, got to know each other really well. And I think, with some people it's a fear of, I don't want to share my secrets, because that they're going to get my clients or something like that. There's that kind of like scarcity mindset, but you just need to flip that around and just have an abundance mindset and say, well, actually, okay, we may both be well-being coaches, or we may both be leadership coaches, or we may both be this or that, but actually we're 2 different people, and we're not going to attract the same kind of clients. And there are plenty of leadership clients and plenty of well-being clients in the USA alone,
Right.
So like, actually, if I can help them, then they'll help me as well, and it all kind of, and, they may have a client who they don't think is quite the right fit for them. And they say, do you know what, go and see Riva. I think you get on really well with her. So there's that kind of, symbiosis there, I think.
And I love what you said. I mean, that abundant mindset, Adam, is so important to have, versus constricting yourself to say, the world is so big and I'm going to meet my goals and I'm going to be able to help as many people as possible.
Yeah, absolutely. Well, you've given us some great kind of tips anyway. Do you have any kind of final take-home messages, any other tips you'd like to share?
Yeah, I think my biggest, I go back to finding your tribe of people and keeping open and keeping curious about sort of those new roles that come into your life, right?
Yeah.
And being able to sort of bravely leap in the unknown. It sounds a little cliche, but really being able to partner with other people, being able to not handing your power over to your circumstances, but really taking that responsibility to change your own life and say, I'm going to find the path, and I may stumble and I may fall, but I'm going to keep moving, and I'm going to just keep reaching out to people that really will help me, and taking that one step and one step and one step and one step, just keeping moving.
I love that. Don't hand over ownership to your circumstances. Don't be a victim of your circumstances. That's so good. Take ownership, take control, embrace the failures. They're all learning opportunities, aren't they? And essentially, as you said, go outside your comfort zone. That's where our growth occurs, isn't it? That's the kind of growth mindset side of things. So that's all fantastic advice. Thank you. So what are you currently excited to be working on that you'd like to share with the listeners?
Sure. Well, I'm growing Lotus Clinician Wellbeing, and the information will be in the show notes, I'm sure.
For sure, yeah.
We do coaching, we do assessments, we do webinars. I just got back from speaking at a CME seminar where we talked about growth mindset, to amplify your point about growth mindset, and self-compassion. And in this time as we're still sort of in the midst a little bit of that COVID and all of these things going on in the news right now, I think there's so much compassion fatigue. And so I'm working on talks with compassion fatigue and imposter syndrome, secondary victim syndrome, where we definitely have a lot of errors that occur, and how do we move forward from those errors. So I'm growing my business. I consult to medical organizations internationally, and I would love to work with more medical organizations on clinician well-being.
That sounds brilliant. Yeah, congratulations on all of that.
Thank you.
That sounds really exciting, and the especially that you talk about the second victim phenomenon as well. I'm kind of reading up on that at the moment, and have reached out to a contact in Austria, actually, who set up a website called Second Victim. Another kind of thing, kind of consequence of coming out of the same consequences as moral injury and that kind of stuff. It's really interesting concept, isn't it? And really interesting work that's going on. So, amazing that you're leading the way, talking about that. So thank you. If any of the listeners would like to reach out to you, and I really hope they will, what's the best way for them to do so?
You can go on to our couple websites. It's lotusclinicianwellbeing.com or lotusphysiciancoaching.com, and send me a contact information, and I'll reach back out to you, and we will start a conversation.
Brilliant. I'll make sure those links are in the show notes. Well, finally, to close, do you have any final words that you'd like to share with the listeners?
I want to say thank you to you, Adam, for starting this Inspiring Women Leaders podcast and being such an amazing male ally. I think this journey for you, for all of us, and I'm so excited to go on to this journey with you, is going to be authentic. It's going to help so many people internationally. And I'm very excited that you're doing this.
Thank you so much. Yeah, I do. I hope so. I'm, as I've said to you, I'm ambitious for it because I think there's a need for kind of practical leadership know-how to be imparted to people from experts like yourself. And
you're amplifying that message.
Thank you. Thanks so much. Yeah. Well, listen, thank you again so much for coming on the show, sharing all your wisdom and your brilliant advice and being kind of open and honest and vulnerable. I appreciate that. And I know it's not easy. So thank you and
welcome.
Have a great day.
Thanks, Adam. Take care.